All right, welcome back. We are here with Morgan Campbell, Laura Packard, and Catherine Sevier. They are answering your questions about healthcare enrollment, ACA, which the deadline is August the 15th, as well as Medicare. All right, this question says, my husband recently started on Medicare. He turned 65 in May. Companies keep calling him to offer him other programs at no cost. He doesn't need extra things because he's covered by my teacher's retirement healthcare. Does he actually need extra coverage? Morgan?
No, he does not need extra coverage. And also, she can request that they stop calling her husband. That is unsolicited phone calls. And unless he actually gave written permission, those carriers should not, or those companies should not be contacting him at all.
Okay. And it's such a complicated issue. This question, Catherine, is if you're already on Medicare, can you change your plan now instead of later this year?
No, you can't unless you had a qualifying event. But if you're already on Medicare, there's nothing that you can do until open enrollment starts again in November. And then you have an opportunity to change it.
Okay, so the Medicare re-enrollment is November. Okay.
It is.
This next question.
October. Sorry, October 15th through December 7th.
October through November. Yep, ends in November. Okay. This person says, my wife is covered under Medicare due to retirement. I am not at retirement age. Can I qualify for insurance under the Affordable Care Act?
Absolutely.
Okay, so they don't all have to be on the same thing. All right, this next question, Laura, they said that they may have gone to the site to enroll for ACA and it was closed. Maybe they went somewhere else by accident?
I'm wondering if maybe they were trying to get health insurance through their employer and their employer's open enrollment period ended, because the enrollment period for the Affordable Care Act at healthcare.gov ends August 15th. So I wonder if they were going to a different site.
Okay, healthcare.gov. And you know, sometimes we like to Google things and we think we're putting in the right stuff and there's all these entries coming in on Google, but that doesn't mean that those entries are the correct one that you need to hit. Laura, this person is asking, can green card holders apply for the Affordable Care Act insurance?
That's a good question. Morgan, do you know the answer to that one?
If they have a visa or a number, they absolutely can.
Okay. And that's not obviously a question that is asked very often. Okay, I'm glad we were able to
back from the memory bank.
answer it for you. Okay. This person says, what if your husband is under part-time insurance? Can I, the wife, apply for health care for myself if he gets Medicare? I need additional insurance. That's an interesting question. I'm not sure if she's asking that the right way.
Well, if she's not eligible for Medicare, she can always apply for health insurance through the Affordable Care Act at healthcare.gov, regardless of her husband's situation, I believe.
Mm-hmm. Okay.
It's the age that's going to be the determining factor on that.
Gotcha. All right. And this person is saying, if I wanted to change healthcare, what do I do? So, Laura.
Go to healthcare.gov. If you already have a plan, you'll be able to log in with your login information and change and make different selections before August 15th. And if you are not already signed up through the Affordable Care Act, you can go to healthcare.gov and create your first account and sign up before August 15th.
Okay. And again, that August 15th sign up, that is going to cover you from that August 16th time, right, all the way until the end of the year. There's going to be another sign up for ACA healthcare, and that comes later on this fall, and that is for the next year.
Correct. So that's going to start November 1st, and that's going to run through December 15th. We are hearing that there could be some changes where they would extend it to January 15th, but that has not been confirmed yet.
Mm-hmm. This question is, do I need extra health care during COVID? I don't know that. I know that Medicare does cover many things when it comes to COVID.
COVID itself shouldn't cost you to need more health care. But having a secondary or supplemental plan if you're on Medicare is really an important thing to look at, because Medicare does not cover all of the costs of your care. And you definitely need to think about how you pay for prescription drugs.
And how you pay for prescription drugs if you are a Medicare recipient, what are your options?
So there are a couple of options. One is to have a Part D plan or a supplemental plan that pays for Part D. The other is to look at Medicare Advantage and make a decision whether or not you want to be part of what we call a Medicare Part C plan that has a prescription drug benefit attached to it.
Okay. And they're asking, is there a deadline to sign up for Medicare? We're already in August. I'll be 65 in September.
Yes. So this is our favorite question. When you are approaching your 65th birthday, you must sign up for Medicare 3 months before the month of your birthday or 3 months after. And during that time, you need to look very carefully at whether or not you are covered by an insurance, a worker insurance policy that allows you to put off signing up for Medicare Part B. If you put off signing up for Medicare Part B and then later decide to sign up for it, you could face a penalty of 10% each year for the rest of your life as you're paying for Medicare. So it's really important that you sign up during that window and understand whether or not you have coverage that would allow you not to sign up for Part B.
Yeah, and that is complicated. I know even my dad got mixed up in that, and he is paying that penalty for the rest of his life because it wasn't explained. And, you know, a lot of times you just say, hey, do I need this? And people say, well, you don't, or whatever else, but they don't explain it fully.
So please get help with this. If you have any doubt at all, people like Morgan are available. The North Carolina SHIP program is available. There's a lot of information out there. If you're working, your HR department should be able to answer those questions, but don't let that time slide without getting help.
All right, we want to put these graphics up so that you can clearly see what's going on here when it comes to Medicare. So you do have to enroll when you are 65, and if you miss that window, it's a 10% penalty. That penalty does not go away, and this is what the different parts cover. Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B covers certain doctor's services, outpatient care, medical supplies, and preventative services, and that's what they're saying. You have to make sure that you sign up for it and then decide that you're not going to use that if you have other stuff. Part D covers your prescriptions. Medigap is Medicare supplement insurance that helps fill the gaps in original Medicare and is sold by private companies. It helps pay things like copays, coinsurance, and deductibles.